Let me tell you what it's like having an ultrasound-guided breast biopsy. So in my particular case, I had had a mammogram. They had detected tiny, tiny calcifications on the screening mammogram, which led them to recall me, re-examine me with a different type of mammogram, and then do a mammogram-guided biopsy. That was really uncomfortable in the sense that I was sitting there for about 20, 30 minutes with my boob jammed in a machine while this nail gun type hollow needle was fired into my breast. Sounds pretty brutal, but actually they made it quite bearable with all the local anaesthetic and TLC. The ultrasound was slightly different. I went in and first thing that happened was the ultrasound radiographer used the gel and a probe to just rub all over this breast, looking at all the different lumps and bumps and things that were in there, and very clearly identified the lump that needed to be biopsied. They also had a very, very good look at the other breast to make sure that there was nothing in there that had been missed on the other scans. Then once they'd done that, the radiologist, who's the doctor who specialises in imaging, is called into the room. And the radiographer by then has gotten all these beautiful images, and she had them up on the screen there. The radiologist also then wanted to have a quick look himself, just to orientate himself and satisfy himself that, we were looking at the right lesion. Lesion is just a fancy word for a lump or a cut or, some kind of injury or abnormality. So they saw the one that looked very unusually shaped and odd. That was the cancer, and so they've scanned that quite thoroughly, marked the skin, and then put in loads and loads and loads of local anaesthetic. Thank goodness for local anaesthetic. Then rather than having the whole nail gun approach, which the mammogram one was like, in this case, similar but human guided. So he actually used the ultrasound to guide the direction of the hollow needle down into the lesion, and then sort of 1, 2, 3, bang, kind of nail gun thing, but it was all hydraulically done rather than by a machine. So yeah, it wasn't too bad actually. It was a bit uncomfortable with the pushing and pulling. As he explained to me, my breasts are quite dense. So there was a lot of physical having to push quite firmly through the dense tissue to get it to the point in the lesion where they wanted to do the biopsy. And they took 3. These are called core samples. They took 3. So they got one down and bang, got that sample. I went, oh, good, it's finished. And then he said, right, that's the first one. Now the other 2. And okay, here we go again. So yeah, it wasn't all over just after the first one. There were 2 more to go. But no, it all went pretty well. A bit of pressure on the boob afterwards to stop the bruising. And then I toddled off to have lunch with my sister. So I was feeling quite fine afterwards. And the local anaesthetic, even when it wore off, I wasn't in too much pain. Just a bit of Panadol was fine. So yeah, it actually wasn't too bad considering. I think the overwhelming thing at the moment is just that I've got so many appointments looming in future. Already I've had the first mammogram, I've had the recall for the second 3D mammogram, and then later that day the mammogram assisted biopsy. Then after that went and had the MRI scan. Then the next day spoke to the surgeon, got their opinion about that, and she wanted me to go off and have ultrasound-guided biopsies, which is what I was just talking about. So that's kind of a lot of appointments for just a 2-week period, but I'm very, very grateful that they've gotten onto it so swiftly, and also just feel very, very privileged to be in a part of the country with the information that I have and the resources at my disposal to be able to get treatment really quickly. But most of all, that it was detected early enough that it's got fantastic survival rate. So I know that not everyone watching this is going to be in that position. Maybe it's a lot harder for you to access care. Maybe it's a lot harder for you to be able to go and access those tests. Maybe you even need to move from the country to a city area for a while to get all of that done. My heart goes out to you in that circumstance, because to be, taken away from your home and have to deal with all of that must be awful. Here I am sleeping in my own bed every night, with all my family around me and my friends for support. So I know that not everyone's in that position. And, believe me, we're all thinking of you, all of us who are in your shoes with the diagnosis. I feel for you a lot, and I'm thinking of you.